We quickly look at the APA. That's aldosterone producing adenoma. Okay, aldosterone producing adenoma. So you basically anything OMA, you're talking about a tumor growth. So this tumor growth is causing aldosterone to be produced too much. Now, where is aldosterone produced in the body? Aldosterone is produced from the adrenal glands. So if you are talking about an aldosterone producing adenoma, it's definitely a tumor growth in the adrenal glands. Where are the adrenal glands found? The kidney is below here, like a bean, like beans, They have the adrenal glands on top of the kidney, like a peacock. Okay. So this is kind of like different types of the adenoma. So it's also benign tumor of the adrenal gland. And when the tumor is there, what is a tumor? A tumor is a cancer growth, right? Well, mustn't be cancer. If you say cancer, it's like malignant, okay? But it's benign. Do you understand? But once it's there, it's making it that the cells are no longer under control. They're just functioning anyhow, and they are making it that the release of aldosterone is too much. So it often presents with high blood pressures, sometimes low potassium. It's curable because it's benign. Okay, so it's a non-cancerous adrenal tumor. Okay, and it makes it that the adrenal cells adrenal gland cells are just producing aldosterone too much. So aldosterone will be so much, and it will increase sodium and water retention. It will raise blood pressure. So people that have this aldosterone producing adenoma, they usually have high blood pressure. So it will cause primary what? Hyperaldosteronism, which is also known as the Conn syndrome. So symptoms is what? High blood pressure, just like I was saying to you guys, because what? There's retention of fluid back in the body a lot. Okay. Potassium levels will be low, causing muscle weakness, muscle cramps. The person is weak, you know, headache. Okay. Excessive urination and taste. As you are putting out more water, you are feeling to replace more. Tingling and numbness in the hands and feet, mostly because of water retention, sodium and water retention. So it causes edema, can compress your nerves, you know. So it can lead to stroke, heart attack, atrial fibrillation. So it's usually associated with some mutations of some genes, like the KCNJ5 gene, the KACNA1D gene, the ATP1A1 gene. Okay, so I think that's what we got. You diagnose it from blood test. You try to check for the levels of aldosterone. You compare it to the levels of renin. That's the ratio. Then other tests like aldosterone levels and potassium levels singly. Then imaging, is where you can image, okay, around the the abdomen to see, you know, if there's any tumors in the in the adrenal gland. So treatments include surgery, where they can remove the tumor out. Okay. And you can give the aldosterone receptor antagonist, okay, and so potassium sparing diuretics. If surgery is not possible, or if the two of the glands are affected, you can't remove the two of them. You just have to what? Manage it,